Okay, so I think the recording has started. Okay, so welcome everyone to come to our third workshop together. 所以欢迎大家来到今天第三个CPPCUK 的第三个workshop。然后呢，今天咱们的这个 workshop 主要是讲这个跟大家解密一下assistant psychologist 还有psychological wellbeing practitioner 这两份目前这两份工作的这个工作内容还有对就是就是我们的 panel 跟大家分享一下他们是怎么进入到这些工作的这个经历这样子。Yeah, so today our panel will share their experiences, their journey, and their reflection about working in these poses as assistant psychologist and psychological well-being practitioner. Okay, and for the just to start with a disclaimer, so recording is in place throughout the whole workshop, and then the recorded videos will be uploaded to YouTube and Bilibili, and you can find us by the name CPPCUK, and all the opinions and journey shared here are not representative of the profession, NHS, or the views of organizations that our panel workshop panel members work in. 就是免责声明，就是说我们今天所谈的所有内容都是我们的嘉宾的个人分享并不代表所有专业机构或群体的这个意见这样子。OK， 那我们今天这个workshop 会有3部分。第一部分呢，就是邀请我们的4位非常 lovely 的这个非常可爱的这个嘉宾来跟大家分享他们的一些现在工作的一些经验然后呢，第二个然后呢就会oh the slides are not working. No?
Yeah, we can only see the first slide at the moment.
Oh, what about now? Can you see
we
it now?
Can't see slides.
Oh, will you guys be able to do it? Or let me try again. What about now? Okay. You know what? I'm gonna just share my whole if I can just share my whole window. Can I just share my whole desktop?这样子可以吗？这样子可以吗？ Does this work now? Okay. Sorry. So, all right. So it should be better now. Okay. Yeah. So we have a panel of 4 very lovely friends today. So yeah, and then so they will introduce themselves in both English and Mandarin, and then in the panel discussion is gonna be conducted in English, and then finally we have a Q&A. Okay, so 所以我们今天的讲座有3部分第一部分是每位嘉宾他们会大概10分钟的时间介绍一下他们现在的这个工作的这个岗位的内容然后对他们以及他们之前的一些经历，然后呢对，然后之后呢，我们的这个嘉宾就会有一个大概30到45分钟的一个 discussion 然后最后呢，我们会open the floor to people listening in the workshop, and then we can answer any questions up to at 2 o'clock. Yeah, so that's the plan today. 对，然后最后一部分是我们会有一个现场提问的一个环节。然后呢，现场在来参加讲座的这个朋友们呢，就可以到时候可以举手提问题然后我们这个提问环节会到2点左右。对 ，OK， so start with Martin， 所以Martin， 对，你那边听得到吗？
有声音吗？有声音吗？声音了吗？听到吗？
哦，我可以。
好，就是好。那我现在是一个 assistant psychologist， 我现在在 CAMS 里面 ，CAMS 就是 Children Adolescent Mental Health Service， 主要是做5到16岁的小朋友吧，5岁以下是另外一个 service。那主要看到的呢，一般都是 anxiety 或者 depression， 但是会比 IAP 的程度会高一点。一般 IAP 呢，它不会 hold 任何的 risk， 而且呢，一些 service 它都会是做一些非常 structured 的，一般来说就会经历那个1年的 training， 然后它很多时候做的 therapy 都是会比较 manualized 的一些 therapy。那在 core camps 里面呢，会做的事情会更多，比较复杂一点，接触的人群也会比较多一点。比如说会接触到 trauma 呀，会接触到 OCD 啊，就即便在 AP 的 level 里面，你都会接触到这些的presentation。那我现在会做的工作基本上主要分为3个方向。第一个是做 history taking， 就我们 camps 就在 camps 所有的 service 里面呢，你都会接触到 ASD 或 ADHD， 就自闭症和过度活跃症的一些小朋友。那他们部分呢，因为他们是要了解到你从出生到现在是不是都是有一样的 developmental 成长的问题，那这些问题呢，他就会需要有一个人来帮你去记录一下。那我一个方面是做这个工作，另外一个方面呢是做一个QB test，QB 叫 quantitative behavioral test， 中文我不知道是什么。简单来说，它是一个测 ADHD 的病症。它就是也需要它去透过你做一些不同的小游戏来决定你的那个 ADHD 的3大指标，就是 attention level、activity 和 impulsivity 3大程度到哪了。然后呢，透过这个我们再来做一个诊断。这就是一个我诊断不是我做的，诊断是由 ADHD specialist 来做的，但是我就负责去做这个assessment 去给他。另外一方面就是做 take duty calls， 就是在任何的 service 里面，在任何一个 service 里面呢，你都会有一个 duty desk 的。那 duty desk 呢，他就会负责来接任何的 referral 来做一个最初步的判断，到底你有没有 risk， 到底你今天需不需要我们今天来见你，还是你的 risk level 没那么严重，或者是你的问题是不是 mental health problem。因为对于children service 来说，很常见的就是沟通问题比 mental health problems 更大。就是很多时候，特别是当你有 neurodiversity， 就包括刚才说的那些读写障碍或者 ADHD、ASD 当小朋友有问题的时候，爸妈会觉得，我从小养的小朋友都不长这样的呀，为什么你这样？那肯定是你的问题，不是我的问题。会产生这些沟通的问题，这些方面。另外一方面是 behavioral 的问题，比如说因为小朋友还小嘛，你在教一个5到8岁的小朋友怎么去表达他自己的情绪呢？他不会，他很多时候都会诉诸于行动上。那爸妈就会很简单的，为什么你这么不听话？那这些其实不是一个 mental health 的 issues， 它其实更多是可能是 school based problem， 或者是一些沟通的问题，这就会超越了 CAMS commission 的范围了。那这些问题我们就要去做 duty， 其实有没有可能不是我们 service 服务的范围，而是另外一些 service 能够提供更好的服务呢？
所以那个就是 referral 了，对吧？就是如果是对，
对，一方面是 referral， 一方面是 risk assessment， 因为你也要知道，即使他今天是沟通问题，但是他比如说 hold risk 了，他已经有一个告诉爸妈我要死了，但我们必须也要去见他，因为这也是牵涉到 risk assessment 的问题，而只有 mental health service 有这个能力，你不可能把一个有 risk 的小朋友抛到 counseling 那边去，因为他们没有这个能力也没有这个配套去 hold 这个 risk。那对了。第3个就是自己 hold 的 case load。那 case load 这方面呢，就是取决于你自己的个人能力或者经验，或者你老板到底有多信任你来决定他不复杂的 case 给你。我老板对我们都挺信任的，派的 case 都挺复杂的。然后然后他比如说我接过的有 ASD 加上 OCD 加上 phobia 的，然后或者是 trauma 加 anxiety 加可能 ASD 的，然后一些 trauma 加 ADHD 来问 OCD 的，就是他很少在 CAMS 的 level 里面，因为以前可能在10年、20年前，你会见到一些很 straightforward AP 会做一些很 straightforward 的，光 anxiety 一个没有 neurodiversity 没有任何家庭问题的人，然后就光做这些 anxiety 的或者 depression 的问题。但到今天为止，因为有 school based system 有 IAP 的存在， 你基本这个 case 已经被 filter 出来了，你不会再接触到这些。你到了 call campus 程度，你会接触到的都是有很多不同的 complex presentation 叠加一起的case。然后一般来说呢，我们就会有weekly supervision 的，就是你的老板会问你，你今天做的怎么样？你的 case 有什么问题？我们应该怎么去走？然后每一部分呢，都因为最后签字的是他才能 hold responsibility。作为一个 AP， 我们是没有能力去 hold 的，所以我们必须要去 consult 他，做每一个决定都要 consult 他，因为我们才可以 proceed 的。那之前在 AP 之前呢，就是我是一个 trainee PWP 来的，trainee PWP 就是 IAP 那边IAP 做的。就是我刚才说的，他会有一个1年的训练，包括6个月呢，就是做一个在学校里面学习，然后后面6个月呢，就是做一些见 clients 啊，做 assessment 啊。IAP 我做完之后，我感觉的理解就是你今天在学怎么开车，他做的呢，绝对不是最好的，肯定不会教你是最好的东西，但他教的绝对不会是错的，你做了它，你肯定不犯错。但是它不会是一个最强、最有效，或者是最有方法的，最有接触到最好的 client 的一个职位。为什么这样说呢？其中一个原因是，比如说用一个 human touch 的角度来说，就是你任何的 psychotherapy， 它做的其实是人与人之间的交流。但是 IAPS 就当纯是我的批评哦，不代表大家一定是 P2P 的经历。但比如说你在对了，这纯粹是我个人的感觉。比如说你在 IAPS 里面呢，你会很少能拿到这个 human touch 的程度，因为它所有东西都是 structuralized 的。你今天第一个步骤要做什么 risk assessment， 第二步骤是什么我 review 一下 homework， 第三个步骤是什么告诉你下一个 homework 要做什么就没了。因为它成人呢 CYPWP 就是小朋友那边的 PWP 他们是不太一样的。那 PWP 那边呢，它只有半个小时。必须是半个小时，不能超过它。而且
现在改了，现在 Ronnie 他们说好像是15分钟了，对
，15分钟
是15分钟，是15分钟。
对，那整个事情都非常
structure，
对的。然后你做，对你每天接多少 case load， 你的 assessment 怎么做，然后你的 case note 怎么写，每一个事情都非常有 template。他们没有错，他做这样的事情，因为你今天是一个。假设你是一个刚做 support work， 没有接触过任何 therapeutic work， 然后直接去进入这些框架的话，它是提供一个非常好的基础给你，但是只是一个基础，这是我的理解。那在 PWP 之前呢，我是一个在读 master， 然后读的是 clinical and health psychology， 然后当时我也做了一些 support work 的工作，主要做的是一些比较 severe 的 mental health issue 基本上都是一些不能说话schizophrenia 或者是 bipolar 的一些，你会接触到很多 challenging behavior。challenging behavior 就是会有一些打人呀，或者是因为他们已经不懂得怎么去处理自己的情绪，感觉来说你就是像是一个3岁的小朋友放在一个15岁的人的身体里面，那他任何不满他都会靠咬打这些方法。那这些但也是一个很好的经历去理解一个人，你怎么可以在这么困难的情况之下也维护他作为一个人的尊严。因为很多时候你会看到一些比较做的资深一点的，他就会觉得既然这么麻烦，为了省时间我就自己把你所有事情都做了吧。但他们虽然是 non-verbal， 但是他们也会有自己的自尊呀，自己的情感呀。比如说一个简单的例子就是刷牙，很多 support worker 都会直接把牙膏挤好再给你。对他来说，他虽然情绪表达不太好，但他也理解知道说，原来你觉得我连刷牙这么简单的事情我都做不到，需要你来。这也是一种你去最基础体验到什么叫站在别人的角度来想他的事情。就是对他来说，有些人可能一直以来都是没有问题的，但是他突然间经历一个很大的 stressful events 转变了，令到他出现了schizophrenia。那但是他还是有一定的认知能力的呀。但是你做以及很大程度上会伤害到他的自尊，也会让你们之间的信任有一个很大的断裂。然后在之前我是一个 SEN 老师，我做的事情也不少，就各个行业都接触了一下。SEN 老师，对的，就是没有。然后SEN 老师做的呢，因为我在香港来的，香港 SEN 他 主要是推行融合教育 ，SEN 是 special education need， 就是做一些特殊教育的，就比如说今天你有读写障碍，或者是你有轻度的学习障碍这些东西。那在传统的学校里面，最起码在香港的系统，其实在英国也是一样，香港的系统里面呢，老师其实没有一个专门的训练去怎么去配合一些 SEN 同学的需要。那比如说他就会这些就会导致老师根本就不知道要做什么事情，让比如说一个 ASD 的小朋友，他觉得太吵了，所以他开始大叫，他开始跑来跑去，老师不知道怎么处理这个事情，因为他根本不知道原来他觉得太吵了，那所以就会需要我们这些有一点点 psychology 的训练的人，然后去做一些课后的补课，然后跟老师去沟通一下，到底为什么他会这样，我们可以怎么做到？因为在香港你要见一个 education psychologist， 我上次查好像17个月，CP 也是要12个月。那你小朋友都1年了，老师都要疯掉了，很多人把你踢出学校了。那他这个最基础的训练或者社工，或者是我们一起来帮他去做一些最基础的 psychological education， 我们到底怎么可以在有限的资源之下配合一个简单好一点的环境给他们呢？或者是比如说简单的把小朋友把一些有需要的小朋友分隔到另外一边去，或者是安排一些 buddy 给他，因为比如说 ASD 的小朋友很需要一个 structuralized environment， 他很需要有人陪着他，他很需要一个我知道我每天上课都会见到这个人的这种感觉，那可能会安排一些 buddy 给他，这些也是可以让他感觉到更安全的方式，大概就是这样。
好的，非常好哇 ，Martin 这个时间把控得很厉害哈，非常棒，谢谢。然后等一下我们那个 panel discussion 会有更多的一些这些方面的这些讨论跟 reflection。对，那我们现在就下一个邀请那个 Jenny。然后我想问一下，你们现在能看到那个panel 讲话的时候，你们看到他的那个屏幕吗？因为我这边看不到。你们能看到 panel 在那边在 share 的时候，能看到他说话吗？
我能。
哦，你能是吧？哦 ，OK，
我也可以。
好的，那就是只有我而已。OK， 行，没问题。好嘞，那Jenny 对，Jenny，请你介绍一下你现在的这个工作。对
，Hello，大家好，我叫 Jenny，然后我现在的工作是一个 full-time assistant psychologist，然后我在一个 adult community mental health team 里面工作，它是英国 NHS 系统的这个 secondary care，然后它有一个很神奇的特点，就是因为它是 community mental health service，所以就是说它会接收很多。它的 referrals 来源是非常的广泛的，所以我们有很多病人是 very complex mental health difficulties， 就是他可能有一些症状符合某个 diagnosis， 但是又没有严重到能 meet 那个 criteria 进入到那些 specialist service， 比如说他有 psychosis， 但是他有 psychosis 症状，但是又没有严重到进 early intervention of psychosis 那种，或者他有一些进食障碍，但是他又不符合进那个 eating disorder service 的 criteria，所以我们 service 接收很多这种就是 very mixed presentations 的病人。我们的病人因为我们是 adult 嘛，在 adult mental health service 在英国这边就是17到65岁的成年人。然后我的目前的工作这就是我面对的 client group。然后目前的工作内容我大概分3块讲嘛，一块就是 clinical， 一块 research， 最后一个就是 admin work。至于 clinical 呢，因为我们是CMA 就是 community mental health team， 我们是一个 multidisciplinary team， 所以我日常工作除了会跟我的病人之外，我们的同事也是来自 mental health professional 的各个领域，包括 psychiatrist 啦，occupational therapist 啦 ，social workers 啊，还有mental health nurses，还有甚至是一些IPS， 就是帮助病人找工作的那一些类型的职位。所以就是我是在这个 team 里面 work 的，我们是 work as a team to formulate the best care plan for the patient， 所以我们 team 就是比较讲究一个 holistic recovery rather than just targeting one's symptoms。所以我在 clinical 上我的工作，因为我是个 assistant psychologist，我大部分做的是deliver brief interventions，大部分是 CBT inform， 因为大家都知道 CBT 是全英国 NICE guidance 最 evidence-based 最推崇的。但是因为我的同时CBT base，然后我们是比较推崇一个 transdiagnostic model， 就是说不是说只能治 diagnosis of anxiety 或 depression， 我们是 CBT base。比如说我的 treatment package 有一个 brief intervention for social anxiety 或者 behavior activation，然后这些其实可以 apply 到很多 diagnosis 的病人，因为其实我觉得绝大部分的 mental health difficulties 的 basis 都是 depression 和 anxiety， 就是这种症状是是大部分病人都会见到的，所以一些transdiagnosis brief intervention package 包括 such as like emotion regulation， 然后behavior activation， 然后还有sleep intervention cope with voices 等等之类的，其实是可以 apply 到，就是 brief intervention 可以 apply 到比较多人的。对，这是 intervention 上我做的。然后另外一个 clinical 上内容，我觉得我个人就是对我做的比较多的，应该就算是 formulation 吧。这是作为一个 psychology， 基本上是我们的硬技能必须要掌握的。
对，
好像中文比较讲的多的是个案概念化。然后因为我们 formulation 有2种，我 formulation 一是跟我的 supervisor 和那个比如说我们一起在 shadow 一个assess， 比如说我们一起在 assess 一个 client 的话，比如说像 Martin 说的 history taken 啊 ，make sense of 就是他的 difficulty 啊，然后包括问一些特别是如果比如说他 suffer 这个好几年了，然后会问他为什么。Why do you think at this point you want psychology， 而不是之前，就会问这一类的问题。然后通过整一个过程，我们就就是 formulate， 就 kind of develop 一个 hypothesis， 为什么他会经历这些困难，以及是什么在 maintain 这个困难，这是我们做的比较多的。然后其次就是这是1对1，可能是跟病人比较直接的 formulation， 当然我们会将我们这个 formulation 跟病人 share。第二个是在我们的 NDT multidisciplinary team 里面，有时候我们会讨论一个，比如说新的 referrals 啊，或者有时候有care coordinator 或护士会将他们觉得比较难的 case 放下来 discuss， 问大家有什么建议。这时候作为 AP，我的工作之一就是也是用心理学的角度来。就是给这个 team 提供一些建议，说这个 client 可能怎么样，他会就是比如说他来自一个 culture， 因为我们本人是可能因为我本人在我的 team 里面算是少数族裔，所以我会比较关注 culture 的 background，然后我有时候会比较关注他们一些难题，他们的一些 client 的 maybe cultural cultural sensitivity， 比如说有的，我一个例子就是我记得一个印度裔的，我们一个病人是印度裔的男生，可能在他20几岁，然后 very hard on， 就是其实是非常 high social function 的 achievable， 但是就是然后然后整个 team 当时 discuss 的重点可能就是会在讲说这个 medication doesn't work 啦，或者说，因为那个 client 他非常没有动力学习，继续完成他大学的学业了，然后我当时就指出说，因为我觉得，比如说中国和印度一些亚洲的文化可能会对这个 personal achievement 的强调会比西方这边要更多一点，所以我当时就提出了这个点。对，这就是 formulation 的一 part 了 ，group formulation， 你用你心理学的知识，对，这是 clinical， 然后 research 就是我 我现在有在做一个 service evaluation project， 就是 service evaluation 就简单来说就是调查你这个 service 的一些 practice 中，做了什么，然后有哪些地方需要改进的，因为整个 NHS 非常强调 service users experience 或 involvement， 所以我现在做的一个 project 是调查和 explore the experience of carers， 因为就是比如说病人的伴侣啊，或者父母啊，或者女儿，就是照顾病人的那些人，就是在调查他们的经历和他们就是有没有在我们 team 的得到什么 support， 或者需要我们再怎么说，提供更多的 support， 这是我现在在做的一个 service evaluation project。然后，对，过程要包括递交 ethical proposal，ethical proposal 啊，然后包括联系找 potential participants 来采访这种之类的，所以这也是我个人比较喜欢的一部分。然后第3部分就是 admin， 就是包括一些，就是很多 AP 都会做的事，就包括一些开会，你要写开会记录啊，然后平时要 manage waiting list 啊，然后对，这是主要的 manage waiting list， 然后及时 feedback 就是因为有时候我们 psychologist 会讨论 have referral meeting， 就讨论一些病人，然后说他们的决定他们的 treatment assess， 就是决定，比如说这个病人 make sense， should we offer them an assessment or we need more information from the referral。然后有的时候我就要负责feedback to this referrals， 跟他们说我们 team 的决定，比如说 we're happy to offer an assessment， 或者说我们对他一些 risk issue 或者 basic needs 还不是很确定，你可以给我们一些更多的 information 吗？等等之类的。对，这就是我目前主要的3方面的工作吧。
对 ，Jenny， 不好意思打扰一下，因为我们这个我看这时间，也许你能花大概1-2分钟，就是简单说说你之前有什么相关的工作经验吗？
相关的工作经验就是想想，我本科的时候每个暑假有在国内的医院 shadow psychologist，或者shadow 心理治疗师以及精神科医生。然后学了一些就是跟病人相处，还有 handle difficult conversation, aggressive behavior 的沟通技能，我觉得这个是比较通用的。然后这是其次呢，就是我 master 的时候，有个placement module， 然后我就也是做了 honorary assistant psychologist， 做了6个月，然后我就是主要是靠这个经验升上的我的 AP。
好的，那能方便介绍一下你的那个master 吗？就是他是在哪里读的，叫啥名？
我是在 King's 读的 master， 是叫 MSc Developmental Psychology and Psychopathology， 然后它有一个必修 model 是就叫 placement， 还有30 credits， 然后 placement 当时也要竞争，就是有 clinical的 placement 或者 research placement 也蛮激烈，然后我当时就选了 clinical placement， 对，然后当时也有面试，然后就过了，对，就这样子。
那很厉害了，真的，好，非常厉害，对。然后 Jenny， 对，等一下我们可能panel discussion 的时候也可以再讨论一下现在工作遇到的那些困难之类的，还有收获之类的。好的，那谢谢 Jenny， 然后我们接下来是邀请 Ronnie 来介绍一下然后 Ronnie 应该是用英文 present 对吧？
我想用英文，我本来想用英文，因为我准备了英文的讲稿，但是我发现前面的2位嘉宾用的都是中文，然后我可能会切换，可能有一些翻译比较生硬，大家不要介意。Hello， 大家好，我是 Ronnie， 我现在是在我把它翻译成是心理健康咨询师实习生，英文的话就是 trainee psychological wellbeing practitioner，简称是 TPWP，或者 qualify 以后就是 PWP， 然后我是和 Hammersmith Fulham NHS Talking Therapy 一起工作。现在之前这个名字是 IAPT， 但是我们最近在 rebranding， 所以正式的名字现在是 NHS Talking Therapies。第一个问题是就是我目前的工作，所以因为我目前依然是一个实习生，所以我会有4天的时间是在诊所。1天的时间是在 UCL， 之前是2天，现在是1天在 UCL 学习。在诊所的，我主要讲我在诊所的工作吧。我在诊所的工作的话，可以从3个方面讲。这3个方面的话，一个是出诊，一个是治疗，还有一个是其他的培训或者是其他的 admin。那如果是出诊的话，就是 triage 或者是 assessment。这个的话，每天都有工作量，当然，然后大概就是45到60分钟要做一个 triage， 然后 triage 的话主要是做step 2的 mental health problem， 就是从 mild 或者 severe level of depression, GAD generalized anxiety disorder, phobia, OCD, PTSD, body dysphoric disorder， 就是这一些 step 2 mental health problems。每个 service 不同，但是我们 service 的话，现在做 triage assessment 会是 focus on this。第2个主要的工作内容的话，就是treatment 或者就是做therapy。那我们现在做的主要的心理治疗，接待的客人当然是像 Martin 刚才其实也简单的说了，可能是比较 low risk。然后是比较 common 比较普及的心理健康问题，像是depression GAD 然后phobia panic disorder。然后我们用的疗法是认知行为疗法，以认知行为疗法向导的一个自助的一个 I can't translate it， 但是英文的话是对 self-help， 所以就是在NHS Talking Therapy 里面说的话，这个 name 是这样子 sounds like this， Cognitive Behavioral Therapy Informed Guided Self-Help。 然后的话大概会有6到8个 session， 我们现在有一点 wiggle room， 6到8个 session， 但是每个 session 尽量是30到35分钟，然后也有 wiggle room， which I fight for it。
You need to, yeah.
I have to。 然后大概 techniques 我们用的主要是CBT base， 那主要的用的一些 techniques 或者是一些 strategies， behavior activation, worry management， 或者是 cognitive structuring， graded exposure， 像这一些就是一些 example。那其他方面的话就是 weekly supervision，supervision 每个 service 不一样。那我的 service 的话，你不仅有跟自己的 supervisor 一起的那个 supervision， 就是督导，1周1次，还有就是我们 service 会给那种小组的督导，互相督导 group case supervision。 我们的 service 还会组织 reflexive practice， 就是大家一起去反思讨论自己的一些 case。然后当然还有一些其他的 trainings， 不管是 NHS 那边也好，还是我们自己 service 这边也好，它会提供很多的 training opportunities。 像我们最近 Anthony 去了，我没去，我比较忙。有一个我们刚刚的 training 好像是 formulation， I believe that's the right one, Anthony. I can't remember. Yeah, that one. 所以会有一些其他的一些 opportunity。至于目前接受培训的体验的话， I personally think PWP training is a really good training, not only because it's funded, but also looking at the skills that you developed. 所以主要看的当然钱是一方面，你是 funded，
重要一方面。
对对对，另一方面当然是这个 program 对你的能力的培养。当时我要申请这个 PWP program 的时候，因为我之前做的是 AP， 我的CP 就是 clinical psychologist， 他其实是不支持我这个决定的。他觉得你为什么要去做一个你这个 belief person center 的人为什么要去做一个这么 manualized 或者是 structured 一个 program， 但是我看重的是你从里面能学到的什么，你从里面能培养的什么技能，而不是说，工作内容当然是一部分，我觉得它是一个很好的起点吧。如果你是做咨询或者是做就是 therapy， 我觉得是一个 good starting point， 特别是里面对你的能力的培养。就目前来说的话，我觉得 training is really good so far， 也有可能是因为我和一个我自己很喜欢的 service， 就是如果是你是做 PWP 的话，哪个 service 很重要，每一个 service 的体验不一样。
对，
跟我的 service 的话，我对我的 service 很满意，它就是对你的关注度很高，然后给你很多就是 training opportunities， 特别是 team members，your colleagues are very very nice， my colleagues are very nice， 这是我觉得很重要的一点。然后很多能力上的培养，我觉得就是目前来说 I'm learning what I want to learn， 因为我之前从来就没有 therapy experience， 那这是一个很好的起点，它给了我一些很好的really good skills like agenda setting, which is quite important, how to use like combi to check in with the clients regarding their understanding of the rationale, to problem solve like any barriers and concerns they have while doing therapy. Those skills are so important, and if you don't start somewhere, you don't have it. So it's a really good program for you to start with. Oh, Anthony.
Well, maybe it might be good to explain what combi is. So I have to explain what the framework involves as well, just so everyone knows the combi stands for.
Yeah, briefly. So combi stands for capability, I believe, opportunity, motivation, barriers, I believe. 然后就是在做therapy 的过程中 it's quite important for you to check in with your clients, their understanding of the rationale, whether they understand the nature of their problem, whether they can make the time to do the home tasks, and how motivated they are to do the home task, because that's a really important part of CBT. 就是这一些技能，像这一些 little tips I've never known before, but I'm learning it from this program, and I really appreciate what they gave me. Although in the long run, I do agree with what Martin said. It's quite manualized. It is quite structured. And yes, I agree with what Martin said. The criticism is true. So there are pros and cons there. 然后我觉得这个 training 还有一点很好的就是 it gives me a really good opportunity to reflect on my own clinical work. 就是你真的是去花时间去反思自己做的一些clinical work， 比如说我们最近在做的，我们要 record 我们自己的therapy sessions， 或者是 record 自己的出诊，然后我们真的是要回去听自己和client， 然后去 analyze yourself。 我觉得这个是 I've never done that before. It's challenging, but at the same time it's very very interesting, and I'm amazed how much I learned from that. Like at the beginning, every 10 seconds I need to take a break, but now I can just listen to it, analyze myself. 我觉得这一些能力吧给的都挺好的。然后还有一点当然就是我觉得这个 job 给你依然是你是 in the community， 所以很多就是population 或者是 people you work with, they varies. It's very challenging, but it's quite meaningful. 至于我之前从事什么工作，或者是之前有什么相关的工作经验，很快的说一下，我的 background 不是 psychology， 所以我是转专业来的。对，我是转专业来的。我的 background 是在 education， 然后我意识到自己想要转专业是在我第一个 master degree. So I've done a master degree in higher education, and I did not enjoy the academic side of that things, and it was really painful. And then I realized I want to do something else. 我在第一个 master 意识到说我不喜欢，所以我在第二个 master is a conversion master. So I did a conversion course with University of Edinburgh, and the course name is Mental Health. I believe it's called Master of Science in Mental Health and Psychology. 所以我花了1年的时间读了一个 conversion， 然后在 conversion 的期间我没有任何的 clinical experience because conversion itself is very intense. 因为它把3年本科的课程压缩到了1年，所以你要在1年的时间掌握心理学的很多基础相关知识，然后包括提升一些研究的research skills， just a lot. I don't have time. I have 0 clinical experience. 我在爱丁堡毕业的时候一点临床经验都没有，然后在爱丁堡毕业之后，我花了3个月，3个月我没有工作，然后在这3个月之后找到了一份healthcare assistant in the mental health hospital, and I worked with a woman with personality disorders. 就是从一个最底层的工作开始做起吧。是，然后这个 role 的话，我觉得有一点很好的就是它真的让我看到了，就是在那个心理健康行业从事是怎么样的，也让我知道这个环境是不是最 ideal， 但是 I enjoy it, I like it。 这就是为什么我推荐很多人在真正的 pursue this area, you need to experience it first, whether you really like it, because in the mental health hospital it's a different world. It's very, very challenging, but at the same time it's very interesting. 然后我最后在4-5个月之后就辞掉了这份工作，主要是因为他的那个管理不行，医院的管理不行，倒不是因为病人或者是同事怎么样，主要是因为管理层对我们员工的人身安全没有做好很好的管理。这是为什么我当时辞职的原因。我辞职之后去做了1年半的research assistant， 因为我很明确自己的目标 ，my goal is to get on DCLIN， 所以我知道我需要 clinical experience as well as research experience， 所以我做了1年半的 RA， 然后 get my name on a couple of papers， 然后之后，但是在我做 RA 期间，我有做一些 little bits and bobs。我有做什么 support worker 或者是 volunteering work， details you can see my Redbook account， 我在小红书上有写，大家可以去看。然后在1年半之后的 RA 之后，我觉得我 research experience 有了，我需要更多的 clinical experience， 所以我又去申请了一个 assistant psychologist。所以 before my TPWP, I was a senior assistant psychologist. I worked alongside with 2 clinical psychologists， 然后我主要做的是 autism diagnoses。就是对于 AP post, I know it's really, really hard to get, but when you want to do an AP role, make sure you like it first. Do you really like the population you work with? Do you like the work you do? 然后我的话，我觉得我做了一个正确的决定，因为我的临床导师给了我很多的非常多就是临床上的一些经验，很多我知道 NHS 有一些 AP 你是没有办法自己去做 assessment， 我们直接让你自己去做 assessment， 然后你把你的 decision 告诉你的 supervisor， 你的 supervisor 拍板说是不是可以，就是你的这个决定是不是 OK， 我是不是 support 你，或者是有一些其他需要 consider factors， It almost like you are a practitioner, but they really respect your opinion。然后和 Martin 还有 Jenny 一样，我也做过developmental history, like writing up. I've done quite a lot in that role. I feel like I learned quite a lot from that role. I learned how to conduct autism assessment using ADOS. I know how to write a very formal report, like based on developmental history or ADOS report, what multidisciplinary meeting is like, how to write, I've covered that bit, how to manage a big caseload. 但是 AP 就是比较 limit. I only do certain parts. I only do assessment. So although I had therapy clients, but they keep cancelling on me, so I did not have the chance to learn how to do therapy. I think that's why, in the end, I decided to apply for TPWP, because I know by heart what I want to learn. I want to learn how to do therapy, and I need to start somewhere. That's me.
Thank you, Ronnie. Very thorough introduction. Thank you. Yeah. 而且 very, very clear as well, very structured. So the next one, we have Anthony. So I think because Anthony, you just basically about to start your training, isn't it? So
very much.
Yeah. So probably the first 2 is not maybe it's not that you can answer as a TWP yet. But I was wondering, yeah, maybe it would be helpful to hear what was your experience before you got onto the psychological wellbeing practitioner training?
Yeah, of course. I mean, I think to start us off, I think just building on, to give a little brief introduction. So it's nice to meet all of you. So I'm Anthony, and I'm also a trainee PWP, like Ronnie. And it just so happens that I'm starting in the same service as she is. So that's quite lovely as well. So in terms of like the duties and responsibilities, are quite similar to hers. I think skill sets, she covered all of it. So yeah, just a bit of a brief background of my experience. It can range, and I think the most important thing to remember here is that you don't have to follow a specific guide, or should we say a golden standard, to go into either the AP role or the PWP role. I think that's the most important thing. So to start us off, I was volunteering as a volunteer at a local community care centre, where it was actually supporting people with different disabilities. So for instance, people, actually it can vary depending on the type of service that you're going into. So I think to be more specific, when you're looking into what sort of environment you want to go into, look at the person's spec to see what type of clients they treat. Because what I was going into was not just people with learning disabilities, but it was also people with bipolar, psychosis, and it was quite a broad range of experiences that allowed me to know more about some of the things that people go through on a day-to-day basis. So that was really the start, inspiration to go into the world of psychology. And so after I volunteered there for around 3 months or so, I started to do my undergraduate in psychology with a placement year. And so the placement year was also pretty much the bulk of my experiences leading up to my role as a PWP. So when I went on my placement year, I pretty much underwent the role of a center assistant. Now, this role was actually fairly new. It was at a cancer support charity called Maggie's. And the role itself was actually quite similar in terms of what it was like to be as an honorary AP, because it would involve duties such as admin, which I think Jenny covered quite briefly alongside Martin as well. And it also involves a lot of clinical work too at that stage, where you would essentially interact with clients on a one-to-one basis or on a group basis, where you would try to discern what was their reason for coming into our service. And so the place I was working at, it was predominantly designed to support people, both curative and non-curative cancer, but also their friends and family too. So in there, it would involve support such as offering emotional support, but also therapy, which would predominantly be supported by our psychologists. And just to give a little brief information about Maggie's as well, essentially, it's similar to that of what it's like to work in an NHS service, because it involves a lot of people who would come from multiple backgrounds. So you would have occupational therapists, clinical nurse specialists. So there's a wide range of roles which people will go into from the NHS prior to working in practice. So it's quite similar to working in an MDT, it's just the fact that they're more specific on working with people. And so I think, like everyone else, we were following more of a cognitive behavioral pathway, so CBT in this instance, where we were trying to essentially do maybe 8 to 10 sessions. And that would be something which the psychologist would do here. My role essentially was more to offer emotional support for people, and also liaising with people and agencies to see if I could support them with benefits advice, or they need sort of a support to gather sort of information. So if, for instance, they had inquiries about what their cancer would be about, I would try to support them in terms of looking up a specific type of information. And a lot in that particular role, it was really good because it also gave the opportunity to undergo duties, what it's like to be an RA. So Ronnie described the main duties of what it's like to be an RA, but in this particular role, I was enabled to undergo a qualitative project. So there's 2 types of research projects which you can do. So quantitative, so you consider stats essentially, so numbers and all that. The other one is qualitative, so you consider verbal. So they would use a bit of interviews and questions as well to try and gauge people's answers in this instance here. And so that was a really lovely experience where I would be able to understand more about what psychologists do in order to sort of not only perform therapy, but also undergo research projects. And I think to add in here, the main thing that we need to remember is that with psychologists, even if it's like a clinical or counseling psychologist, their core responsibilities are either to perform therapy in both individual and group settings, and also to undergo research projects too, whilst liaising with different agencies to ensure that they're keeping up to date with their program. And then afterwards, I started to apply for local support work agencies, where for 5 months I was working as a support worker and to support people, again, with learning disabilities, but also different conditions such as bipolar disorder, autism, and I think there was a rare case where we were supporting somebody with.
Sorry, Anthony, I don't think I can hear you. Oh. Can anyone hear Anthony?
No.
No? Oh, I think he froze. Oh. Oh, let me tell him that he froze. Oh, okay. So, oh, maybe. Okay. So, don't know how to get him back. Oh, maybe he dropped out. Okay, so maybe he'll join back again later. Okay, so I am wary of time as well, so maybe yeah, maybe we can go to the panel discussion, and then if when Anthony comes back, then he can if there's anything he want to add as well, then he can add on that. Okay, so so I will open I'll open the floor for panelists to discuss 3 questions. So like I think it's gonna be 10 minutes each about discussion. So the first question is like 第一个问题就是说之前的工作经验是怎么帮你找到现在的这份工作 ？So how did your previous experience prepare you for the current role? Yeah, and I'll open the floor to the panel so you can discuss. Yeah.
要不我先来讲，因为我待会要早走一下，因为有点事情，不好意思。然后
好的，没事。
如果有人有问题的话，也可以有像我问的问题的话，也可以现在问我。大概1点钟左右我就要先离开，不好意思。
对，没事。
我觉得你任何工作其实都会对你的临床心理学或者心理学这个范畴是有帮助的，因为我那天听了一个香港讲临床心理学的 master， 然后他其实不像英国一样，他只限于在做 AP、PTP 这种工作的人才能申请。其中一个他说的一个原因，我觉得很有趣的是，因为心理学是一个做人的工作，你的生活一切的事情，即便你今天是一个 customer service， 你也会理解到人的情绪是怎么变化的，你也会理解到人与人之间相处是怎么样的。就是我们做的工作。当然 skill set 很重要，知识很重要，但我觉得最重要的是你怎么可以先理解你也是一个人，每个人都有他脆弱的时候，你会跟他坐在那儿一起去跟他度过这段时候。很多时候我在 therapy room 看到的问题，我也没有答案的。难道我今天跟你说你破产了，你离婚了，还是你想自杀，我能立马把你抓住，然后跟你说不要吗？不可能的。但是更重要能传递出的信息是，生活很难，但我愿意陪你一起度过这段时间。那所以回头就是说，什么工作经历，任何工作经历都有用的。更重要的是你怎么去理解你与人之间的相处，你对人性的理解，人性有点过分了，但是就是这种你对人情绪变化的理解，人到底是一个那么多样化的事物，你会不会很片面的只从那个 cross sectional 里面，你就是个渣男，你就是一个背叛人的人，你是不守信用的人。人是很多样性的，每个人都是有他自己的变化在的。那你能不能理解到 怎么去理解，或者你怎么理解到这些事情，我觉得都会对你的 AP 有帮助。但凡对你的 interview 都有帮助。但凡你能说出个所以然来，任何工作经验都会是一个很有帮助的经历来的。
好的，谢谢 Martin。那我知道你有急事要先离开，那你先对，那你先去忙吧啊！谢谢你今天来，真的非常感谢，
谢谢你，
非常感谢。那你下次有机会再找你过来聊啊。
可以，好的，谢谢，好的，拜拜。
好，拜拜，先去忙吧。对，然后好，然后我觉得 Anthony 他可能现在还是在try to come back up. Try to get back in. So, if Jenny and Ronnie, 你们两个looks okay, you can start discussing maybe the first question. By the way, can you see can you see the PPT at the moment? 对吧？能看到吗？
现在清楚很多。
好的。
因为之前是在那个 half screen， 现在好像是2/3 screen 是 PPT， 然后1/3是我们的头像。
我想看看你们，因为我当时一直在看着 PPT。行，那我现在那你们现在这个聊吧。你们是想一个个问题放出来，还是全部一起放出来？一个个问题吧，
一个一个来吧。然后 Jenny 可以先，因为我在帮 Anthony source out thing。
OK， 好，谢谢。我觉得在之前的工作中，当然我很认同 Martin 说的，就是 psychologist 就是一个一个非常 use of ourself， 然后把心理学知识应用在生活各方面的这个样的一个职业，所以我非常赞同这一点。然后我觉得之前的工作中累积了什么经验的话，我会说第一方面就是 communication skills 是非常重要的。这个而且由于其实我蛮多实习是在国内的，但是我在就是写 application to AP role in the NHS 我会着重强调我学的这些怎么能 transfer to the population I will work in the NHS， 然后就是要比较就是要写的比较 convincing。然后其次我觉得就是其次的经验就是我想I think it's just applying psychological model into practice， 因为我们都知道一些 CBT model 啊，比如说围绕你的认知、情绪等等来分析你的困难，但是我们人是有很多 individual difference 的，所以有的时候套用 model 的时候，就会遇到各种各样的困难，甚至就最简单的来说好了。有的 client 他甚至是其实有 difficulty 去 articulate 他的情绪，他就只会说我就是感觉就是比如说有口气出不来，然后问他do you feel anxious？ 对，就是他会比较难描述，更细致的描述一些自己的躯体化症状，或者有什么就是 thought 在脑子里想，经过这种，然后你就要去 adapt。用一些 communication skill 等等，或者 rapport building skill 去 adapt， 或者换着一些更 Socratic 的questionnaire 的方式来慢慢的引出慢慢来引出一些他的 difficulties。对，这是也是我算积累的一些工作经验，然后我觉得对找工作有帮助的。
对。所以其实我感觉 Jenny 讲的很多都是那种 transferable skills， 对吧？就是你以前的工作经验，你是累积了哪一些方面的这些其实就是 doctorate 的话，我们会讲是 competency。competency 是那个胜任力，就比如说你可能有一些胜任力是在有的人可能是在 risk management， 就是怎么样去管理一些人，他们对可能伤害别人或者伤害自己的一些 risk。那可能对于 像 Jenny 你说的，就是刚刚分享的，可能就是跟 emotionally 或者是有 complex needs 的人，你是怎么跟他们怎么安稳他们情绪，怎么能够跟他们沟通是不会就是怎么样去sensibly 或 sensitively 去跟他们 communicate， 对吧？就是或者是对，就是怎么样去，还有一个像你说的，就是有一个 skills 是怎么样去tailor the models to personal needs， 对，好嘞。Ronnie 你那边回来了吗
？Anthony 这边还是有点问题，但是我们可以 carry on。然后我很认可你们说的，你们说的就是 transfer。see back。Yeah， 我们要换成英文吗？这样 Anthony 也可以。
Okay, yeah, let's do that.
Join us. So I guess to summarize, Anthony, for you as well. So Martin mentioned about, I think, 2 points about how different are all these people, are the clients we work with, and how you need to know, like, you can interact with people, how you interact with people. And he mentioned about how sort of people from different background, even you are from different sort of discipline, or you work in a different area, you can bring your own unique perspectives and experience in psychology, because in the end, psychology is a sort of interesting discipline. It's not only art, it's not only about science, but it's a combination of a lot of things. So that's I believe is Martin's point. And then Jenny and Anna talks about like the importance of transferable skills, particularly communication skills. So I completely agree with that. I think it's when you apply for AP or PWP role, it is not only about you talking about your experience, what you did, but it's about what you learned from that experience and what skills and abilities you developed from your experience. Communication skills, very important. Yes, and I think Anna mentioned about risk assessment as well, how you manage risk, which is also another really important competencies. Whether you apply for any psychology jobs, and other abilities include like active listening, how do you manage multiple demands or a big caseload. So when you sort of talk about your experience, not only experience from the field of psychology, but also from other sort of area, there are skills, that core skills. So basically, if you want to apply for AP or PWP, it's important to look into the skills, what skills you developed and you have. That's essentially what I want to say. But anyway, I'm going to take a break there and hand it over to Anthony.
First of all, I'm really sorry about that. Why are you anyone? I think to add in here, we briefly touched on core skills that we need to make sure that we're able to apply for the roles. I think one thing that Ronnie mentioned here was the question of what did I learn from this experience? I think the core skill to be learned here is that you need to be able to actually reflect on the experiences that you've attained from your different worlds. So if, for instance, you think about your prior experiences leading up to where you're at right now, you need to be able to ask yourself, not just what have I learned, but you also need to ask yourself, but also question the interactions you've had with people. So for instance, if I'm interacting with a client right now, and then if I also notice there were certain responses being given to me. So if for instance, this person usually is quite a bubbly person, they're really happy, they usually interact, in a positive light. But if, for instance, you start to notice that bit of behavior change in people's response, ask yourself, why was that happening? Was there something else that may have caused this reaction? Was there something that happened prior to them coming into our sessions that would have led them to react this particular type of way? And instilling this particular mindset is really helpful, because when you're operating and you're working as an AP, PWP, all the way leading up to becoming a counseling psychologist or clinical psychologist, which I think, Anna, you could probably mention a bit more here. You need to be able to question everything around you, question the experiences you've had with people, but also question everything that's going on around you. The experiences, the interactions, will also question whether or not you've done something differently. You know, could I have done something differently that would have retrospectively gained a different sort of result than what you've actually noticed here? What else can I talk about here? And very briefly, remind me, what point was discussed and what can I actually talk about here? Because I think we talked about quite a lot of things, didn't we? Ella, you're on mute.
Oh yeah, so the next questions would be what skills you develop now in your current role that will help you prepare for the next step, which I think for most of you are the clean side. So yeah, so just a bit of reflection space for you, you free as well. And then the third question is what is the biggest thing that you have learned and the biggest challenge? Yeah, so yeah, does that answer your question?
Yeah, I think so. So I think in terms of skills that we will learn, I think reflection is a big one. I think I've already talked about reflection so much, I'm just going to avoid it right now. The other thing that I would say is the ability to communicate. So we've already touched upon that already as well. That's good. I would say something that may not have been touched upon that much is the skill of being emotionally resilient, because in the roles that we're going into, you know, I think Ronnie may have mentioned this as training PWP, but the roles that we're all going into will be incredibly intense to the point where there would be such a high caseload. Now, obviously, I can't say much because I haven't started training just yet. I know I'll probably be complaining to Ronnie in about 5 months or so, but we'll just leave that aside for now. But I think the most important thing to remember is that, you know, it is perfectly normal to find yourself feeling at an incredibly low point, because the roles that we will be going into, it will be intensive. It will be incredibly challenging, because you will come across so many different cases and conditions where you will just question yourself and say, bloody hell, why am I going into this particular role? Why am I putting myself through all this? And so I think, you know, when you remind yourself every single day of the purposes you wanted to have of going into that role, it will give you that bit of motivation you need in order to push forward right here and there. And so emotional resilience is one thing, because it gives you that sort of, how should we say, mindset and ability to plow through whatever sort of challenge you're going through. But I think as a bit of a caveat right here, I would also say, when you start to feel those sort of emotions where, you know, it feels incredibly overwhelming to the point where you just want to just stop everything and quit training, I would say it's a point where you can actually have a bit of discussion with your supervisors, or your line managers too, because that's what they're here for. They're here to guide you to lead up to become who you want to be. And so, you know, often at times you can actually use supervision just to vent your frustrations. Because I know there's a buddy of mine who's currently in the same trust that me and Ronnie are working in. And I think there was this history where they would love to vent about whatever it is that they're going through. And it can help. It really can. I mean, Ronnie can probably add in some stuff into here, but I think just having that safe space to vent out your frustration when you feel at a particular low point is really beneficial, because it allows you to remind yourself that, yeah, you know what, I am human. I will face a lot of struggles here and there. Ronnie, have I missed anything out here, or have I just completely breezed through that part of section right there?
I think it's really good point, and how you talked about resilience. I really like how you talked about it. I agree with absolutely everything, but I also wanted to highlight one thing I learned from our trust or our service is in one of the reflexive practice, I think I learned this from colleagues. Resilience is not about hiding or hiding your emotions or pretending you are okay. And this is not resilience. Resilience is also about when you, as a human being, either as a therapist or as a student, like all of you, or as a client, is about the ability at the difficult time, about ability to reach out to other people and ask for help. And this is a part of the resilience as well, which I think is an important quality working in the field of psychology, because I know my old friend called counseling or clinical psychologist or any roles in psychology as she used analogy like a trash can. You're basically other people's trash can. Not necessarily true, but what I mean is, my point is, you will experience stress, you will experience anxiety yourself when absorbing some negative energies from the other people, and don't feel like you have to suffer it all by yourself. Like reaching out, talking to your supervisor, talking to your colleague is also an important skill to have. I don't know, Jenny, if you wanted to chip in and share a couple more things on the resilience point.
Yeah, I definitely agree. I can resonate with resilience a lot. Especially, I think one thing I learned is that maintaining compassion to the patients while it's also a big part that alongside resilience, because sometimes patient might be because of some misunderstanding or the nature of their mental health difficulties. We may receive a lot of misunderstanding or distrust or aggression from the patients. But I think under these situations, one thing like like both of you mentioned is the self-care is really important and maintain resilience. But the other hand, we also need to be mindful that to keep, I think in this kind of difficult, tough situations, yeah, we are sometimes maybe the church being, but we still need to maintain compassion for our patient. It's also a challenge, but I think that's something. I think the job, one of the biggest things I learned is definitely I think my emotion capacity has also growth and strengthened during working with some of the difficult clients, to be honest. Yeah.
Yeah, I guess like since Jenny, you started you started the third question. Shall we just like elaborate on that then? Or do you want to share a little bit more about like maybe what are the biggest things you have learned and the biggest challenge you have encountered? Maybe you can start, yeah, or whichever way you want to go. But like, how do you feel like, oh, did I freeze? Yeah.
I think you're fine.
Anna, you're fine. We can still hear you.
Oh yeah. So I guess like for the second question, I was wondering a bit more about for the third one, it's like what are the biggest things you have learned and what are the biggest challenges? So like essentially, I guess it's like how do you feel like you are different now as a person, or like in terms of your clinical skills, and what are the things that you find the hardest to overcome? Yeah.
Is Jenny still there?
Yes, sorry. I'm thinking like the biggest thing I think I've learned is to honestly just to be reflective on all your practice all the time. Besides looking at the part that how what like Anthony says, what I could do differently or what how I could improve the next time. I think also self-compassion is quite important. And well, the biggest challenge I have encountered on this journey, I would say it's a bit related to personal situation because I mean I don't have any permanent visa or identity permanent visa or permanent residence, that kind of thing here when I'm working. So when I started work, I used the PSW. I still remember the on the edge anxiety last year when my PSW is about to due and I can either go back home or so I was striving to find a solution to sort out my visa, and eventually luckily my trust promised to sponsor skill worker visa for my post. So I personally think that's what my biggest challenge in the 2 years, like in terms of both me as personally and professional development, because sometimes I feel like we might see the entrance rate of international student and locals getting into decline. It's like we know we know that if you're applying as an international, your chance it's like you need to be like top 1 or top 2. It's just much harder than the international than the locals. But I also believe that maybe it will take a bit longer time for me who don't have a permanent residence to get in. But as long as if I know that's truly my goal, I think I'm willing to wait a bit longer if that's my situation. So yeah, back to the point of resilience. I think so. That's my biggest challenge. Yeah, I'm gonna be honest, because that the visa situation, it's take up a lot of anxiety of my life last year as upon reflection. Yeah.
Thank you, Jenny. I think I agree that, like, just it sounds incredibly unsettling. Yeah, I think it's like a huge uncertainty that you have to live with on a daily basis, because it's like essentially it could be a big life decision as well, whether you get the visas to stay here, and then especially with the visa, like, entrance salary is so much higher now. I think it takes incredible amount of like determination, and then courage to pursue this, because to some extent it's a little bit like a gamble, isn't it? Like, you're investing all these years of work and life into this, but if we are very honest, this is a very highly uncertain journey about whether you can get to the doctorate. It's not the only way. There are lots of ways that you can do therapy, but if that's your goal, I think it takes lots of determination to get there. So you have done a really good job, Jenny. It's really hard. It's really challenging, and it's incredible where you are already here, where you are now in this journey. So well done. It's an accomplishment by itself already.
Thank you.
Yeah, you still froze, by the way. I still see you in the same picture, but I can hear you, so that's fine. Yeah. Okay. What about Ronnie and Anthony then? Do you have any thoughts about this then? About the biggest challenge and lessons? Yeah.
Because we're on the topic of visa, I wonder if I should talk 1 or 2 things about the visa.
Yeah.
I am surprised NHS gave out sponsorship to assistant psychologists. So Jenny, really, really well done. It must be so amazing. It must be so good for them to gave this out, because it's so hard to get
Actually, it depends on the trust. Some trust offer and some trust doesn't. So we just have to have a lot of email communication with HR. Oh my God.
Yeah, I resonate with that, because with the EPWP training, I had some issue with UCL, particularly about my visa. So a bit sort of story about my visa. So I'm lucky. I found my husband, and who gave me dependent visa. So after my Edinburgh degree, I used dependent visa, and I used dependent visa till this day. So I used the dependent visa, depend on my husband, and to get into the EPWP training. And the reason I can use the dependent visa to apply for EPWP is because the dependent visa allows you to work as well as to study in the UK. So we check the government's policy. We read through the government policy. For the PSW visa, post-study work visa, why you can't use PSW to apply for the EPWP is because the post-study work visa only allows you to work in the UK. It doesn't allow you to study in the UK. So that's the main reason why you can't use PSW to apply for the trainee course. And Jenny, like Jenny said, you can use PSW visa to apply for the AP role. That's absolutely fine. But if you are interested in the trainee PWP, then you need to sort out, basically they're saying you need to sort out your own visa that allows you to study and work in the UK for 1 year, so the length of the course. If you can sort that out, then I don't see a problem why you can't apply for the course, which is sad. It's really sad. I completely disagree. And UCL spend 1 to 2 months to give me student card because they're trying to sort out this visa thing. So yeah, all the fuss about the visa. Anyway, that's the visa thing. I'm gonna maybe go back to the final question and let Anthony to talk a bit about his experience.
Did you want to say something?
Yeah, just want to add to encourage people when you are applying for maybe probably mental health support worker, when you're searching the job in NHS, if they have a paragraph talking about sponsorship, things like people who need skilled worker will be considered equally with other candidates. They normally, if the trust have agreed to sponsor post like this, they will put this out. So I strongly recommend you guys who wants to work in the UK, when you're applying this job, if the trust put this paragraph out, just go for it. No matter what, go for it first. Yeah.
That's a very important tip. Thank you, Jenny. Yeah, I think a lot of people are wanting to get on this journey, but they're also worried about whether they can actually find a job and things like that. So yeah, and we'll open the floor I guess soon and to see if anyone have questions. So yeah, but I think let's go let's go with Anthony. Like, what are the biggest things and challenges you have encountered on this journey so far?
I think one thing I learned, I think it's a combination of something I've learned, but also it's been a huge challenge. It's the fact that I've learned how to be authentic to myself. And so I think we briefly touched upon this, where there would be brief moments. I think all of you have experienced this at some point where, when you tackle a tough situation, there could be times where you just want to keep it within yourself. So for instance, if you had a very difficult interaction with a client, for instance, there may be times where you just don't want to, just discuss it in further detail with your supervisor, or there may be times where you just don't want to say that you've done something wrong for any fear of backlashes from your supervisors or your seniors in this instance. I think the biggest thing that I've learned is just to be honest and say, at times I will struggle. I may actually struggle to find out what I can do with how to perform an administrative task, like how to do a triage, a treatment plan, etc. There will be times where you will just be struggling. And I think I just learned that, it's just good to be honest with the team around you. Be honest with yourself. Do you feel as if you're struggling at one particular element of your journey? And so if you are, find those around you who you can have a chat with, be it with your supervisors, with your colleagues. I mean, Ronnie already knows that I'll be asking her loads of questions in about 5 months in, so I'll just apologize in advance for that already. But I think the biggest challenge was that it's been difficult as well to try and be honest, because when you're going into a new path where, for instance, you've never started therapy or you've never performed any form of research-based tasks or duties, it can be quite challenging for you to say, what, I'm struggling to perform some form of assessment. I'm struggling to do, for instance, how to do a T-test in SPSS. It can be really challenging at first to admit that, you will have difficulty or you're struggling at first. But I think once you get over that sort of mental hurdle to say, what, yeah, I'm here right now, but I will be struggling at some point. And so I think it's about ultimately being honest with yourself and saying, yeah, just ask the question honestly. Just go forth and bring forth that sort of curiosity within you. Because the sooner you ask questions to your supervisors or your colleagues around you, the better you will be as a practitioner. Because if you can imagine this perspective here, when you're a counseling or clinical psychologist, you've already made it at a very good stage of your career. Having said that, you will still be asking so many questions. Now, it may be because you'll be wondering about a client's presentation, or you may be curious to find out, what was going on prior to them coming here to your individual service. And so when you start to instill that sort of mindset to question everything around you, and when you're able to be honest with yourself and honest to those around you, you're able to be a really, it really influences the way you operate as a practitioner in psychology, because when you're interacting with clients, you have to be honest with them. You can't always just give off a sort of fake persona to show that, I am keeping everything together. At times you will be struggling. And I remember this very well because when I was working as a center assistant, there will be times where, you have a bad day at work. You will be struggling with admin. You'll be struggling after having a difficult interaction with the client. That's all perfectly natural. And so when you're honest with yourself and others, it allows you to practice freely as a practitioner. So I think that would be the one thing I can say as one of the things I've learned and one of the mental challenges that I've endured as well on this journey. I'm curious to hear Ronnie's perspective, because you briefly touched on the visa issue, and I think that in itself is quite a tough journey. I think for all of us here, despite the fact that, there's so many mental challenges ahead, I think it's commendable that all of you who are on this panel right now, you all want to go into this particular pathway. So I'm going to give you props for that, because it is not easy. It is not easy at all. To start off by finding a job in mental health, that's already difficult. And the one thing I should say is that a lot of times when you're doing your undergrad degree, or if you're trying to venture off to get mental health or clinical experience, it's going to be tough, because there will be times where it's unpaid. And so obviously that will play a massive role to see, do you want this particular role? And so if you're going for roles which are, how should we say, if they're volunteer-based roles, it would be really important for you to try and speak to the line manager or the supervisor to say, could I try and only do this maybe once or twice a week? So you're not draining yourself of funds whilst you're trying to study as well. And so that would be something that I would say is really important to bear in mind. And I would say just keep at it. Just keep at it, honestly. Because if, for instance, you're living around London, there will always be some sort of placement available for people, whether it be as a healthcare assistant, a support worker, and there may also be opportunities to work within the NHS as a healthcare assistant or support worker. And so just looking around every single day for those experiences will be really helpful for you, because it allows you to narrow down what you want to do in the future.
That's some really good reflection there, Anthony. I think I really like the point you say, being authentic as well. And I think that is actually tied into the way I see it, is it's related to being curious as a psychologist or aspiring psychologist. Because I think a key trait for me, I think a very important or a characteristic trait of psychologists, in my understanding, or people in this profession, is that you're curious about other people. You want to get to know the people. You're going to know what happened to them, what they're going through, and then what's going to help them. So if you're curious about other people, it's very important that you are curious about yourself as well. And then when you say authentic, I feel it's also a lot of reflection and just really getting to know yourself, because the way I connect with people is I feel I connect with them in distress, because essentially, like Martin said earlier, we are all human beings. What other people going through, what you're going through is very similar. It's very relatable to what other people are going through, maybe to different extent and to different levels and in different contexts. But at the end of the day, we are all human. It's yeah. And if you're curious about yourself, if the more you learn about yourself, and it's also the more you can understand other people as well. So just explaining on that, I think that's some really good points. Yeah. All right, guys. So I think that's the time for Q&A. So 就是现在可以大家就是现场提问的这个时间，就是大家有任何问题吗？就是现场听的朋友现在可以提问题了啊。好的，来，王子欣来开麦。
喂 ，Hello， 您好，请问可以听到吗？
啊，可以，你说吧。
好的。首先特别想感谢一下大家的分享，因为我觉得就是我在听的过程中，我觉得最受鼓舞的一点是觉得每个人都有他很独特的那个 journey， 然后就觉得好像我们就是虽然说还没有开始太多，但还可以创造自己的一个 task， 所以首先就特别感谢大家。然后我今天就听下来觉得有
不好意思，先不好意思，先 interrupt 一下，我有点担心 Anthony 可能会听不懂。Can you understand what she's saying, Anthony?
I can, yeah.
Okay,
yeah,
sorry.
Yeah,
sorry to interrupt.
Oh, it's okay. It's okay. I can use English channel. It's okay. Yeah, I just want to say that actually this quite inspiring for me because I find like everyone is taking their unique journey to their destination. So also inspired me. So I have like roughly 2 questions for our session
panel.
Today. Yeah, as for the panel, I think the first question, like quite confusing for me for a very long time. I want to ask a panel, like, how do you think about your training background and your population you will like provide a service to? Like, for example, for me, if I want to have like practitioner training in the future in UK, but I would like to provide service to maybe people from Asian background, or I want to work, for example, in Hong Kong or in mainland China. Do you think that I should take the training program in UK or other foreign country, or maybe locally in Hong Kong? I feel always confusing because like I feel like every culture is quite different, and they're sometimes the problem they are facing also different. So I want to like hear some advice from the panel.
Shall I?
Jenny, I think you should go ahead because I don't have any clinical experience back in China. I'm not familiar with the system back home, so you can start.
I would say I think UK is one of has the most advanced training system in the world for therapist in the therapist career wise. One of the things is that because I personally also work in China, I find that one of the biggest difference in terms of therapy training is that NHS here emphasize a goal-oriented recovery, which they tend to. I think NHS here tend to encourage the client to make their goal sort of clearly rather than abstract, rather than just like want to live a more normal life or better life. But in China, that's why also they focus on CBT so much. And in China, however, in China, because I have worked with therapists with humanistic and systemic work background. That those are, to be honest, those are more, and also psychoanalytics. Those kind of therapy maybe have a more focus compared to CBT. They're more focused on exploring journey, like, and they probably don't have a limits of sessions. Like we assign you, unlike NHS here, they will say like we offer you maybe 10 to 12 CBT session, but in China, or I don't know how Hong Kong works, that at least as far as I know in China, this they normally go by session and see how it goes rather than set a plan at the very beginning. Say that the number of sessions or the length of therapy will be arranged. That's personally I think that one of the biggest difference. So I mean, as a starter, I would probably prefer more guidance type of training.
That's true. It's also important for like as beginner, like you need really guidance, like some guidance to help you. Yeah, totally agree. Thank you so much. Sorry, I also have a brief question for Jenny, because I feel very interested in the formulation Jenny mentioned before. Actually, in my job currently, I also feel a little bit of struggle, like how have the formulation for specific case. Jenny, would you recommend some sources or books or any materials we can learn, like to improve the formulation skill?
I think there's one. There's one something called Psychology Pocket of Formulation. I can't remember the full name, but I'm happy to type it in the chat later. That book introduced different types of theory and formulations, such as CBT formulation, trauma-informed formulation, and a narrative formulation, etc.
Oh, okay. Thank you so much. It's really helpful.
I do have those 2 books. Do you mean this one?
Oh.
Yes.
Yeah, so this is the first one. I can take a picture. If you're in our chat, I can take a picture and then post it in the chat as well. So this is called the Pocket Guide to Therapy.
Yeah, exactly. That's a very nice starting book.
And probably in Ronnie's bookshelf as well. Last time I checked. So the second one is like recommended by lots of course. It's called Formulation in Psychology and Psychotherapy. I can take a if you're in a group chat, or like you can approach me personally and I can send you the pictures as well.
Okay, no problem.
What job are you working in at the moment?
So currently I'm working in international school and in the department of special education needs. So I work as educational assistant. So usually in like daily work, I need to face a lot of students with a wide range of special needs. But I kind of feel like I'm taking baby steps because we value more on academic achievement at this moment. So I'm trying to find more opportunities in how to improve my skills in psychological field, and also just to find some toolkits, I guess, just to take some steps.
加油，慢慢来。
好，谢谢，很有收获。好，我的问题结束了。不好意思，这时间有点久，谢谢。
没事，谢谢子欣。那下一个是易涵，下一个举手。对 ，OK， hi.
Hi Anna, thanks for organising such wonderful events, and thanks for all the panelists. Your sharing is very informative and inspiring. So my question is about because the whole topic of this event is about your experience as AP and PWP, and that is kind of the golden path to DClinSec. So I'm wondering, in terms of the next step in your career, are you all wanted to pursue your next step in DClinSec? For example, if I want to do DClinSec or PhD in counseling psychology, so that's kind of a better equip me to enter the field as a practitioner. But you guys are already practitioner, so in terms of the next step, is doing a DClinSec the only is that only choice, or is there any other possible routes that you could explore? Yeah, that's my question. Thank you.
I think just to add in very quickly, there was a question about are there other pathways into the role of being a practitioner? There is. And I think one thing that I mentioned briefly was the role of a counseling psychologist. And so to touch on the other question, that's more to do with the more humanistic element of therapy. Because one of the things that Jenny talked about very briefly was how with the DClin and also with our roles respectively, it's far more CBT based, it's far more goal oriented, if you will. Whereas obviously in the mainland, it's far more situated on person-centered therapy, where you would try to take things as it is to see how our clients are doing in this instance. And so with counseling psychology, it is a little bit more oriented towards that part of the realm of therapy. And it's because it's situated on the idea to support clients with whatever it is that they're going through, and not to follow a structured program in this instance. And so if you're finding that the DClin or the clinical psychology path is a little bit too structured, it might be worth going into the D-Psych. Now, the one thing which may be a bit of a drawback about this is the fact that unlike the DClin, the D-Psych is unpaid. So that's one thing to bear in mind here, because if you were to apply to become a counseling psychologist, or excuse me, a trainee counseling psychologist, it'll be self-funded, where you essentially have to take out a loan in order to fund your study, but you also have to, in some way or fashion, fund your way into getting some therapy and placement as well. Because on the DCLIN, and correct me if I'm wrong here, guys, but the DCLIN is paid. The placement are also paid as well. Whereas for the DPSYCH, or the pathway to counseling psychology, that's unpaid. So it's just about trying to weigh up your options here and to determine whether or not there is one path you like more or the other. But I do think with the clinical psychologist path, unless I'm mistaken, you might want to correct me here, but with that path, I think it actually gives people the opportunity to explore not just CBT, but also different modalities as well. So it really just comes down to your preference, but it also comes down to looking at the universities individually, see, what type of modules do they offer? Because if you're finding that there's one course offering more modules leaning towards the person-centered end of therapy, go for that instantly. But if you like the idea of offering more goal-oriented therapy like CBT, then go for that pathway as well. So it's just about weighing up your options here to see what you like more than the other.
Thank you, Anthony. I think I completely agree with you. There's another pathway, though, if you would like to become a practitioner. Psychotherapist is another way to go. I know in our service, there is a route to high-intensity CBT training. So you can be trained as a cognitive behavioral therapist. So as a psychotherapist, you will be very specialized in a particular therapy, such as CBT. However, I recently learned from my colleague that once you are a qualified CBT therapist, it doesn't mean you have to stick to one particular therapy. There are other opportunities for you to learn more, like EMDR or couple therapy. It's just the title. I think one thing why I really wanted to do DCLIN, a part of it is research, a part of it is a bit of leadership, and the other thing is the population work with, it's quite diverse, as well as I like the formulation in the DCLIN psych. I think that's why so far I still want to do DCLIN, although I'm in a talking therapy service, which a lot of people's route is to become a high intensity CBT therapist.
Just adding into that point right there, I mean, I actually appreciate what Ronnie mentioned here in essence, where with the clinical psychologist part, it's not just the role to offer therapy, it's also the role to offer and conduct research and introduce yourself into leadership roles. I think just to add in another point here about the high intensity route is, if you become a trainee PWP and then you're qualified, once you've done your 2 years of working at your service, it does offer you the pathway to automatically apply for a trainee high intensity therapist role. So if, for instance, you're finding yourself in a stage where you want to know, what pathway you want to take, or if you're finding that the high intensity route is more something of your interest right here, try the PWP route first. And then once you've done your 2 years, you can then apply for the trainee high intensity therapist route. And that will give you a straight pathway from that point to train as a high intensity therapist. And obviously from there, you can then try to explore what other modalities you would like to practice in the future with your clients.
Okay, yeah, thank you very much. It just seems that when we thinking about like the next steps, always bear in mind like there are loads of like opportunities, and it really depends on what you want to do. So DCLIN psych is just like only one way, like because it takes too much time, like 3 or 4 years training. I mean, definitely like we need to give a second thought, like whether the time is worthwhile or something like that. Yeah, thank you so much. Thank you.
Thank you, Yihan. Thank you for raising the question. And I think the next one on the list is Yolanda.
Hi, can you guys hear me?
Yeah.
Thank you, Ronnie. Thank you, Jenny. Thank you, Anthony, for sharing. And thank you, Anna, for organizing. Hi, I'm Yolanda. And so I did my bachelor's degree of psychology at KCL. And I went back to Hong Kong and worked for 1 year as a SEN teacher. And I just finished my master's degree at UCL. It's about developmental and educational psychology, and I've been looking for jobs. So my first question is kind of quite specific to my personal situation. I got a job offer, which is to work at a school to support SEN teacher, to support SEN students as a support teacher. So I'm struggling if I should take the job offer because, I like to work with children and maybe apply for decline side and target children and adolescents' mental health. But then this job offer is not actually clinical related. It's not in the mental health setting. So I'm just wondering, is this really valuable or helpful in terms of building my portfolio to apply for decline side? Yeah, this is my first question.
Yolanda, thank you to tell us about your situation, but correct me if I'm wrong, guys. I've done some research regarding decline psych. So if you consider to do decline psych as your future sort of goal, I checked KCL's document, and just KCL, they don't count, I believe, SEN support worker role as a clinical experience, which I completely disagree, because there's so many good transferable skills there that you can bring into the job. However, from the document, they might change that, I'm not sure, but check the handbook, their decline psych handbook. I believe they've excluded it as a clinical experience. By saying that, I think it's really up to you, Yolanda. Like, what do you want from this role and what do you want to do in the future? I still think a lot of the transferable skills you've developed is so invaluable. So I don't know if I'm completely wrong, Anna and Jenny and Anthony, correct me if I'm wrong. But
yes, so maybe decline side is a bit too far away for me. How about in terms of applying for PWP for children and young people?
So on that, there is actually a course, I think, in Exeter, which actually, excuse me, that's wrong. There's a course in the University of Essex that actually offers people the opportunity to actually work and actually train to support people for under that sort of age range. So I think it's called a children wellbeing practitioner. I could be wrong here, but in my understanding, there are different pathways where, because for me and Ronnie's path, we're supporting adults. But I think just to add in here, there has been a recent change where we are now starting to see clients, I think as young as 16, if I'm not mistaken, Ronnie, correct me if I'm wrong. Okay, so there is a bit of a change and push in terms of trying to like diversify the type of clientele that we're seeing. But if you're finding yourself interested in that particular pathway, I think the child wellbeing practitioner role might be something you could look into. But I think just to add in here, with the SEN role, I've spoken to a couple of people about it, and they all find that it's actually quite beneficial in terms of the skill sets that you learn, because it gives you a foundation to understand some of the things that this particular clientele go through. And so if you were to transfer that into a new role, let's say the child wellbeing practitioner model, that can prove really helpful because you already understand that particular skill set of what it means to support children in this instance. Because let's face it, when you're supporting adults and children, there's going to be a huge difference, because you have to be really sensitive to how to approach a client, because a child's understanding of therapy will be completely different to how an adult perceives therapy. And so with that SEN experience, it'll be really helpful for you just to sort of understand how children will react to certain things that you offer to them. that would be the one thing I would say is my main advice in here.
Okay, thank you, Anthony. It definitely makes me feel more hopeful. So my second question is a bit more general. Like everyone else, I did my bachelor's degree. I gained 1 year of working experience, and I did my master's degree. And I'm trying to build my pathway towards my destination, which is the clean side. In between, I still need to gain more work experience and maybe apply for PWP. So I'm just wondering how everyone deal with the anxiety of during the journey that you might fail, you might get rejected for AP interviews, for multiple applications, and to be honest, I've got a bit age anxiety for girls. Like I feel like I'm 24 and turning 25, but I'm still far away from my ultimate goal. So just wondering, how does everyone deal with that?
I think my pathway might be a little bit extreme, so do not take this advice to heart, please. But I think what helped me was reminding myself of the importance of persevering. Yeah. Because one of the things I had realized prior to even beginning to apply for a placement year is the fact that, you know, when you look for these types of roles, it will be extremely challenging. I mean, the amount of times I've heard people reaffirm to me the fact that rejection is a common theme, it's just giving me that reminder to say, you know what, yeah, rejection is quite common, for instance. So I think it's a bit of a blunt form of advice, so do not take it to heart. But what I would say is it's quite important to sort of normalize rejection to the point where you can acknowledge that you've been rejected,
yeah,
but then you push forward. Because one of the great things about this is that when you get rejected from a role, it doesn't necessarily mean that you were underqualified. It just means that you may have done something differently, or there may be just so many other competitors to the point where, you know, the NHS Trust or whoever you're applying for, they have to like dissect it in such a short period of time that they may have actually just missed someone else who's qualified. And so it's just reminding yourself that, you know, yeah, I've been rejected, shit, but then how do I move forward? Let me go into different pathways or different organizations to see if there's any other similar roles that might offer different like experiences, which could be beneficial to you in the future. And also from those rejections, if for instance, you find that, you know, they may have done something, or they may be critiquing the approach that you took, it can be great. I'm not using my words properly. It's a good opportunity for you to actually use this experience to reflect on what you've done differently. You know, could I have done this differently? Could I have maybe said something differently in my portfolio? You know, am I approaching this statement in one way, or should I do this in another way? So it gives you that bit of leeway to question yourself as well. And I know this is a very recurring theme among our panel, but I would say using that ability to reflect on every single experience you've had would be really, really beneficial to you, leading up to whatever your role you wish to apply for in the future.
Yeah, true. Thank you, Anthony.
Jenny, did you want to say something?
Just want to share that I can definitely resonate of the feelings of being rejected. I mean, before I land on my post, I have also other interviews on APs, and also actually I also applied for trainee PWP. Yeah, there was also unsuccessful attempts, or I wasn't even shortlisted. And then even though I'm shortlisted, I may did not survive the interview. So that happens actually a lot before I land on my current job. So yeah, just to echo on Anthony, that I think in this journey working in mental health, rejection is is quite common, but just believe. I think it's important that just don't give up and keep trying. And especially when you can always learn something new from every failed interview or unsuccessful attempt. Yeah, I think comments.
Yeah, great. Thank you, Jenny. I'll keep trying.
Yeah. Yeah, and I guess like just to put things into perspective, you know the retire age at the UK in the UK is 68. So it's gonna be 68. So it's like 40 years that you're 24 now. So it's like gonna be 40 years. That is double the amount of time that you have lived so far that you need to work.
Yeah.
So if that is taking a few more years to get to where you want to be, rather than sticking with a career that you don't want, I think it's like putting things into perspective as well. Like how with technology, we're gonna live very long time, hopefully. So you're gonna work for until you're very, very old. You can if you want. Yeah. So it's thinking about, in 10, 15, 30 years time, almost like what kind of life you want to be and where do you want to see yourself. And if it's like it's a very personal decision about whether you think it's gonna if it's gonna be worth it to take this risk, because it's a highly uncertain one.
Okay, thank you, Anna.
No worries. Okay, guys, I'm just aware of the time, so we're going to take 2 more questions and we might have to finish the session. And then if we have more questions, we can send in a group chat or like you can forward it to me as well. But then I think we have last 2 questions from Lucy and Lumin, and then we'll finish that. Yeah, so if we start from Lucy, yeah.
Hello, everyone. I'm afraid I prefer to speak Chinese because I apologize for my spoken English. Okay. 我首先是想表达一下，就是今天这个讲座非常有意义，我想对大家都是这样，就是它不仅给了一些信息上的共享，然后其实还给到人一种力量，就是让人觉得其实就是有个 community， 你不是一个人在战斗那种感觉。然后其次，我还想花一点点时间回应一下上一位，就是当他说他24岁，然后觉得怎么样，然后我就想说 ，Hello， 我已经28了，然后我也是刚刚决定 change my career path， 就来到这边求学，然后再和我一起上心理咨询课程的其他的一些外国人，他们也是就是听说 ，Hello， 你才28，你就觉得自己已经很老了嘛，就是很多都已经是40、50的一些人，他们想要重新去转变他们的职业道路，去追求心理咨询或者心理健康任何的职业。然后所以我想说，有的时候，而且特别是我觉得对于我们这个职业来说，有的时候你可能就是需要多一点的人生阅历，然后才能让你更好的去理解人。对。然后接下来就回到我的问题，可能是一个很 basic 的问题，就是关于这个 TPWP 的一个机会。就我注意到，其实可能不只有 UCL 有这样子的一个申请项目，其实可能在整个England 它都有一些这样子的就是 NHS 和学校合作的。然后我想问的问题是，就是我很害怕我会 miss 掉一些这样的机会，因为它好像是并没有一些固定的时间会放出来，可能有的时候是这个 Trust 它有这样的空缺，然后它会发布在 NHS Jobs 上可以搜索到，就我不太确定就是怎么样去可以尽可能的不要 miss 掉这些申请的机会，对。这是我的问题。
I'll take this question, Lucy.
Sorry, can I just apologize for leaving? I have an appointment meeting at 2, so.
Okay.
That's all right. Thank you so much, Jenny. Thank you. Take care. Thank you. Bye bye.
Lucy 是这样，确实是不只是有 UCL 有这个课程，其他学校也有。那因为我是只申请了 UCL。因为我知道我只想在UCL， 所以我只申了这一个，然后也拿到了这一个。UCL 的话，就是确实它在官网上可能只给出的一个时间段，但是你可以去官网上 sign up 那个信息，你甚至可以直接给那个 course admin 发信息，问你大概什么时候开放，然后他会给你一个你可以加入他们的 email list，然后 他们开放的时候，那个 email 就会提醒你啊，这个岗位开放了。开放的窗口通常非常短，大概只有1周到2周的时间，它就会关闭。一个是加入，一个是我的建议是联系每个学校的 admin， 拿到他们的 emailing list， 加入他们的 emailing list， 来避免这个情况。我觉得这个是比较就是切实际，当然也不要忙。就是我知道有很多全英国有很多学校是提供那个 PWP training， 当然要明确自己就是想要在哪个学校，想要在哪个地方，然后也不要大量的海投吧。我觉得比较有针对性的，这样自己也会稍微轻松一些，然后也会更有针对性。不知道有没有回答你的问题？
有的，但是因为我也有搜索一些信息，然后有注意到有些学校它的回应是，它要先等就是 trust 那边有这个工作岗位之后联系他们，然后他们才会放出这个，所以我就在想，这个到底是学校主导的，还是说这个工作单位主导的？对，有这样一个疑惑在。
主要是学校主导的 ，recruitment 是学校，initial application 3进是学校，然后 interview 是和 service。
好的，谢谢。
我觉得 Lucy 还有一点就是你可以去那个什么Indeed， 还有在那个 NHS Jobs 上面，你 sign up 一个 job alert， 那个 job alert 叫做trainee psychological wellbeing practitioner。然后我建议你提前先按他的那个 personal specification， 还有那个 job description， 先把你的 personal statement 准备好了。然后它一开放你就投，因为就是你因为那个什么，如果你 sign up 在 Indeed 还有 NHS Trust 那个 jobs 上面的话，它只要通常他们有那个 vacation， 它先 post 在那些 job 上面，你 apply 完之后，他们再让那个university 去 contact you， 再去 select， 就是跟你 meet interview 之类的。对，我当时也是去 UCL interview 的，对，所以应该是就是 job alert， 对 job alert， 然后
job alert 学校的 emailing list， 我觉得这两就差不
多。double insurance， 对，双重保险。
好的，非常感谢。
好嘞，然后最后一位是陆宁，对。
Hello， 可以听到吗？
可以，你说。
首先就是表达一下感谢，谢谢你们，就是谢谢你组织的这样的活动，然后谢谢panel member。Thanks to every panel member who has shared their experiences。
没事 ，Anthony，
好，他已经走了是吗？
对，你可以说中文。
我刚刚也在找他，我有一个问题，其实是especially for Ronnie 的，因为或者就是 anyone who has done therapeutic interventions， 因为我是有一些就是 triage 或者 assessment 的经历，所以我现在就是我对这方面算是有一些了解，但是 therapy 就还是对我来说是比较就是蒙圈的，并不是很清楚它到底是怎么做的。就是我想问一下，你的这个 training process 是怎么样的呢？然后就是 how long does it take you to actually go on to do therapies？ 然后就是你感觉就是这个过程中，大概就是这个过程是怎么样的吧
？Trainee PWP 的话，我们会和在 UCL 那边学习。一方面是在理论上，学习上课学习，2天，2天会上个学期是2天吧。然后一是学习理论，二是在 service。在 service 话，我们 service 非常好，它会让我们去做 shadowing。我不知道这个概念你熟不熟悉？陆宁就是别的 therapist 他们在做 therapy 的时候，你就是坐在旁边旁听，然后这我觉得是一个非常好的学习过程。然后另一方面就是 role plays，然后我们会和 自己的同事啊，会和自己的同班同学一起 role play， 就 actually in the lecture， 就是在那个上课的时候，我们会去角色扮演这样子去练，然后我们还会和自己的导师角色扮演，然后会把它录下来，然后我们导师让我们自己回去听了以后自己去 analyze 有什么可以提高的。所以是2方面吧，一方面是学习理论知识，然后是学校主导的，另一个的话是 service 里面很 clinical， 就是你去当影子，当别人的影子，你去 shadowing 别人，然后还有就是role play， 然后多久的话花了从我9月份开始培训的吧，然后到现在的话，我的 caseload 上面已经有8个 clients， 然后我是圣诞节大概花了3个月。我要去先过掉学校的一些要求，学校的一些assessments， 学校的一些 requirements， 要过 service 那一关。service 那边说，哎，你可以做 therapy 了，才给你做 therapy。所以从开始学到真正自己开始接病人的话，我大概花了有3到4个月的时间吧。我觉得安娜也可以 chip in， 因为你也做过 training。
对，我觉得 Ronnie 已经说的蛮好的了，就是我在想，其实我想到另外一个点，可能是那个 theory and practice link， 就是说理论跟实操的这个连接，其实就是有点像 Ronnie 说的这个是知识跟技巧，就是因为theory practice link 它的意思就是说你怎么把那种理论上面的 CBT model 也好，别的 model 也好，你怎么把这些理论应用到帮这个人的治疗上面。然后我觉得它是有2种不同的类型的学习的，一种是学习知识的，知识就是有点像 lecture 那样子的，你要理解一些概念，你去记住一些概念，你去写 essay 啊 paper 啊coursework 啊之类的，你去理解这个 knowledge 是知识，但是 skills 的话是不一样的，技巧是不一样的。knowledge 我的 understanding 是 what， 然后技巧是 how， 就是你是怎么去develop 你的那个 clinical skills 的话，那个其实是像 Ronnie 说的那样，是要 practice， 比如说通过 role play， 就是说你是来扮演一下病人，我来访，我扮演一下咨询师，然后我们对调角色，然后通过在这个过程中，我们遇到任何问题，可能可以跟我们的老师讲，或者可以看同辈的反馈，然后其实就是心理咨询这条路，治疗这条路吧，不管你是 therapist 也好 psychologist 也好，我觉得很重要的一个技巧的这个治疗的这个能力的培训是通过 supervision， 是通过督导，就是你在 qualify 之后，你会一直就是在通过，因为你会遇到不同的来访，你会遇到不同的问题，有的时候你卡住了，就是这个东西的话，就治疗的话，你就是要在 supervision 里面去学这个技巧，这个东西不是1天2天，它是一个长期的一个终身学习积累的一个过程，而且虽然Ronnie说他从PWP 开学之后3个月就开始接 client 的，但是他其实在那之前已经做了很多的 clinical work 了。刚刚他也说到他做了 AP role， 然后他也做过support work， 然后他也做过 research， 所以其实到那一步的话，他其实已经有 certain amount， 已经有一定的那个临床工作的这个经验了。对，所以不是说对，就是我觉得这个不是一个阶段性的东西，我觉得这个是一个长期的累积的一个东西。
好吧，好的，我大概了解了。其实还是 role play， 好吧，果然在哪里都逃不掉 role play。
是 role play， 然后录下来自己的一些 assessment 或者是 treatment， 然后
那个很死亡，自己要听自己的。
非常的，我觉得那个是我目前 training 中最 challenge 的事情，就是回去听，我每10秒钟就自己脚趾抠地，我听不下去。
啊，天呐，实在是太难了。好吧，谢谢你们，非常感谢，耽误太久时间了。
好的，没事，谢谢你的问题。好的，那谢谢也谢谢大家今天来到参加我们这个讲座。然后呢我们今天这个讲座呢 录下来了，然后呢就会放到那个 YouTube 跟哔哩哔哩上面，然后大家搜我们的频道名 CPPCUK 就可以看到了。然后Ronnie 我知道你有一个小红书账号对不对？大家也可以多多去关注 Ronnie 的小红书账号，你账号叫 Ronnie Y 对吧？
对的，我比较忙都没有更新。
但是对 Ronnie 他上面有 post 很多很好的东西，然后对，也欢迎大家去关注他。然后对，那这期就先这样，然后下次再跟大家见面了。好嘞，拜拜。